You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with MiniDental Implants. One of the newest trends in dentistry are these small diameter or mini implants. And according to my first guest, he says nobody should be wearing a loose fitting denture. With us, we have an expert on this topic, Dr. Otteson. Dr. Otteson, welcome to the program.
Thank you. Great to be here.
Now, how long have you been in Arizona?
30 years now.
30 years?
Graduated from dental school in 1986.
Your dad was a dentist. I guess your sons are dentists.
My two sons.
Daughter is a hygienist.
My daughter's a hygienist. Yeah, it's in our blood.
Is this all you talk about when you're at home?
No, no. The wives wouldn't like that too much. So.
But so you obviously like it. So for people that don't know, and we're talking today, what you could do for denture wearers or people headed to dentures. But for people that don't know your practice, I guess you have one of these concepts where you kind of do everything right there. So who's a typical patient? What are the different services that you offer?
Sure. My practice is in Chandler, Arizona, and we're a general practice. And what that really means to me is generally we do everything.
Okay.
We see families, young children, adolescent, adults, and then we even see the 90-something World War II vet. Back to the question of different services we offer whitening. You can take a 40-year-old, whiten their teeth, and they look younger. It's a great procedure that we do. We take care of fillings and restorations. I'm a metal-free office. In other words, most of the things we use are composites and porcelains that make things look great. Brings your teeth back to what they originally were, without metal in there.
Okay.
We do crowns and bridges. Many of those we can do in a single visit. Because
now you have a machine, I guess, that makes the crowns there.
Yeah, CEREC machine and the milling machine that is associated with that. So with crowns, how it's normally done is you prepare the tooth, you take that goopy impression, we send that off to the lab, we put it temporary in your mouth, and 2 to 3 weeks later we come back, have to get you numb again, and then place it in. But with the CEREC process, we're able to prepare that, we design it, we mill it right in our office, we're able to bond that in the very same day, usually within an hour and 15 minutes.
Is that right? So you've been doing that a while?
Over 10 years.
Okay.
Yeah, love the process, love the technology.
Now you have all the new stuff. Or I'm paraphrasing you slightly, but you said you're kind of like have all the newer technology in your practice.
Yeah, I believe that if we can offer those technological advances, we can get people to get that smile, to get the teeth, to get the health that they've always wanted.
So you use lasers?
Yes, we've been using lasers for some time. We use lasers to help with gum problems. When you've got the loose teeth, bad breath, bleeding gums. We can take that laser and go around the teeth and help save those teeth instead of having to go into surgery. We also, the newest technology we have is what's called the Solea laser. So we're able to do fillings without all the noise, without the vibration, without the smell, and for most of the time you don't have to be anesthetized. Great ability.
So kids are going to probably love that,
kids
or
love
anybody.
It. Adults
Nobody
love
likes
it.
pain.
Yeah, I have patients every day that have told me, hey, I don't mind you, Dr. Otteson, but I hate coming to the dentist. I hate the smell. I hate the sound. I hate that. Someday that day's here. It's here. We have a laser that we can do that without having to get you numb and take care of those teeth.
You do porcelain veneers as well?
Yes. Love those complex cases and cases where we're able to improve the smile and bring back the health and the vitality of the teeth and the mouth and the smile.
So mini implants, why we invite you on the program. You like these.
I love these.
You like them.
It's how we replace teeth anymore. In the past it's been patchwork. We've done bisection, areas and quadrants of dentistry. We can now restore and get back those teeth and get the smile.
Is that right? Now, we said at the top of the show, no more dentures. I guess with mini implants, you could give them full teeth that are what? Snapped on to these, or teeth that don't come in and out? Right.
2 ways really many implants can be used. You can stabilize an existing denture, which is helpful and great. It's a great way to restore, give them stability back to the bite. But at the same time, there's those that we don't need to have have a denture that comes in and out. We can actually lock those onto those to those mini implants.
At the top of the show, we said nobody should be wearing a loose-fitting denture. Are there a lot of people where you are wearing dentures?
Absolutely. In Arizona alone, we could fill ASU Stadium with those who are wearing dentures or heading to wear dentures, heading in that path to wear dentures. You bet.
So if mini implants are so good, why isn't everybody doing it?
Well, here's the thing. My take on it is this. Most people who are wearing dentures have gone through many years of dealing with the problem. They're not even aware that these mini implants are available and are able to use them as a stability or for stability. I'll tell you, the reason we don't see many of these people is because of what they've gone through.
Denture wearers.
A denture wearer. Let me tell you what they've gone through. For one, throughout their life, they've probably had fillings, they've probably had crowns, maybe some gum disease, they've lost teeth, they've had bridges, root canals, and they're at the point where they've lost their teeth. They get their denture, and they think it's over. And so they don't want to come into the dentist. They don't want to see us.
Yeah, they don't want to see you.
No, but they're not aware.
There's a lot of money, too. I mean, it's a lot of money spent, I guess, for nothing.
Right. Well, they've been able to say what they can, but now they're in dentures. And so where do they go from here? And they're feeling like they're done. They don't need to come to the denture. They'll come when they've got a sore or they've got something, a problem, maybe need a reline or whatever. But they're not aware that we can stabilize that denture and make a much better fitting and more comfortable denture. The other reason they don't come in is because they think they're too old. They feel like they can't have this procedure.
Well, how old
these
can
implants.
you be?
You can be 80s into your 90s. I mean, we've had a patient that's been 80 years old that we've been able to stabilize that denture. And you might ask, well, why would an 80-year-old?
Yeah, I mean, it seems like a lot to go through.
Why would an 80-year-old want to do that at this point? Well, I think in today's time, if you're 80 years old, you've been lucky to live to that age, and maybe you're alone, maybe you're in a care facility, and eating's one of the greatest, brings you the most happiness of the day. And so not to be able to chew and function properly. I mean, yeah, with my mother-in-law in the place that she's at, which is a nice place, they're able to eat and she's able, one of the joys she has is being able to eat.
Does she have dental implants?
She does not. She does not, but many of her friends and people there that are living in the same place do. And if I could just get them in and have them be able to place these mini implants and give them some stability, what a much greater enhancement of life that.
So no more traditional dentures.
They don't need to be that way.
They should all be, your philosophy is they should all be attached
stabilized, attached to something. I mean, that's where it's at, and that's what we can do.
Now, how are these mini implants are different than regular implants?
Yes.
How so?
Basically, diameter size. They're a smaller implant. They're also quite a bit less in the way of expense, maybe half the cost. One of the misnomers about implants are that if you need them and you're thinking you might need 29 implants. No, that's not so. If there's a denture and we can stabilize it, we can use 4 to 6 of these mini implants, and they do a great job.
Now tell me about this, because I've had dentists on the show that say the problem with mini implants, they're just not there yet. They're not big enough.
They're absolutely
they fall
there.
out.
They're absolutely there. FDA approved. We have long-term studies. I think I placed my first implant in 2007, and it's still very stable. Single versus multiple implants, they're very, very stable. Aside from they're less than half the cost, there's less downtime. We're able to place those in, we're able to get function back on those and stability back onto those implants much sooner than we could with traditional implants.
Now, if somebody's wearing a denture, isn't it true though that if you've been wearing it like 10 years, you don't have enough bone to do this?
Not necessarily. There are instances where there is not enough bone, but we have modern procedures with grafting and different things where we can get the bone. But for most of the cases, we're able to angle those mini implants and get them into very thin bone. We don't need as much bone. The implants are thinner. These are 2.5 millimeters thick versus a traditional implant that's 4 or 5 millimeters thick.
So no more dentures, no more regular dentures.
No more regular dentures.
Now, you told me in the green room, you've made hundreds of dentures, maybe 500 more dentures.
Probably 500 dentures. And if I could take anything back, I'd love to have them back in the office.
So if they watch this show right here,
right.
You made them a denture, what do you say to them?
I say,
about
come on
implants?
in. Let's have you come in and let's try them. I wish we could set it up to where we could place some minis in there and go for the weekend with them. You'd see a great changing your life and ability to eat. You can eat the salads, you can eat the carrots and the broccoli, and take a bite out of an apple. I mean, that's success.
But can they look like real teeth?
Absolutely, yes. They look wonderful. I had this a lady that's been a patient of ours for a long time that just came in. Her option was a full denture, and we elected to do some mini implants. She was heading to a reunion. We were able to place those mini implants and give her teeth. And let me tell you, when she was able to look in the mirror after that and not, having her old teeth with chips and breaks in there and looked at it, it was very touching, very moving. She is at a reunion this week, and if you could see her smile, it looks wonderful, and she looks great. She looks younger with that younger smile. And there's so many people here in Arizona that have that same thing, that where we could use these mini implants, stabilize the mouth, stabilize the teeth, and give them the smile that they like.
Is this the future of dentistry? Like dentures as we know them today?
It is.
Maybe in 50 years or
who knows? I mean, there's still many hundreds of dentures being made today in Arizona, I'll guarantee you, without stabilization. Mini implants are so affordable. You know, we have patients that'll go to some of these centers where they're given a treatment plan for, the old style larger implants and teeth, which are great. However, mini implants, being able to place the mini implants and get the teeth back is less than half the cost. Why would you not want to do that? I know there's people out there that are in that situation.
And the literature, published articles
Absolutely.
Say that these things work.
They work.
Is
and they're
that right?
stable. They're just as strong as the other implants. We have the same longevity, the same percentage of long-term prognosis with a mini as we do with a traditional implant.
Okay, now dentures. You told me that people with dentures, they can't chew very well. I know a couple of denture wearers. They never complain to me.
Well, Randy, they're not going to complain to you.
Okay.
They're going to complain to me or their spouse or whatever, or they're not going to wear it. Some people just wear them. I have patients that tell me that they just wear it out on social events, just to go, and then they're uncomfortable. They're out at dinner, having dinner, and they've got to excuse themselves and go into the bathroom and conceal it and hide it. I have patients whose spouses don't even know they wear a denture, and they've concealed it, they hide it, they clean it, all behind their spouse. They know nothing about it. They wear it to bed, no one ever knows. Denture wearers don't know what they're missing. They've gone through a process for years of losing teeth and root canals and loss of filling materials and crowns and bridges, and now they have a denture. Of course they're going to adapt. The human body's
Good point. Okay.
Human body is able to adapt greatly, but they're not telling you the whole story. They're not able to chew and function and be able to eat the things that they like to eat. They don't smile how maybe they would like to smile. People with bad teeth, many people think they're poor. Well, they're not poor. Some people think they're mad and angry and upset with the world. No, they're not.
They just don't smile.
No, they don't smile. They've got a bacterial problem or disease within the gums, or they're missing teeth or gaps in their teeth. In the movies, if they want to make someone look uneducated or poor, they'll have them miss a tooth or misalign their teeth.
Okay.
We see that in even magazines and different things. You want to make someone look more successful or
give them better teeth.
Give them better teeth.
They
put these big veneers.
But you're a dentist.
Yeah.
Of course, you think the smile is important. How important do you think it is?
Absolutely. Unbelievable. And it's not really what I think. I do think that, but studies have shown. I can give you countless studies. Muscle and Fitness magazine did a poll and asked their readers, what is it that you look for in determining the attractiveness of the opposite sex? What was number one? Smile. Okay. And the Harvard Business Review, I just read this one, which was great. They wanted to find out the science of happiness, right?
All right.
And to no big surprise, 1, 2, and 3. One was eating better, exercising, and smile. And smile even when you don't like to smile, because there's a chemical, physiological happening that occurs. Hormones are given off, our blood pressure decreases. All those things happen to us. We're more approachable. Who doesn't like to be around a person who smiles?
Yeah.
Right?
So there are that many people, like in Arizona. Can you spot them as a dentist? Like,
Absolutely.
they're hiding something?
Yeah, absolutely. Just within their smile. I think we judge as the first impression. It often tells us who we are and how we're feeling. And absolutely, you can tell. Now, I'm not saying they're angry. They might not be angry, but they look angry.
Yeah, but if you have bad gums, right? You have bleeding gums, bad breath, loose teeth. Can you still do this? Like you've been told, you can't. You have to go to a dentist.
Absolutely, you can still do it. I mean, those are the people. Those are the best people, and that when they've got the problem with their gums or tissues or bleeding or loose teeth, those are the ones we're able to help the tissues get back to health. If we have to remove the teeth, once the teeth are gone, the tissues heal up, and we can place one of these mini implants in there and rebuild that whole smile. Absolutely, those are the type of people that these are meant for.
With the mini implants, okay. Let's say you give them a whole. I guess like, 6 or 8 mini implants, get a full arch of teeth on the lower and the upper.
Right.
What could they eat?
They can eat most everything that they've wanted to eat, that they remember. The salads, the broccoli, the raw carrots. I mean, that's what I hear most commonly.
Can you bite with the front teeth?
You can bite with the front teeth. I mean, they're that stable. We actually have models of them, and we have our patients try to pull those teeth off the model, and it's difficult to pull off the model. They're that stable. They're wonderful. So you can get back to eating those things and feel confident in eating those things in a public environment the way that you always wanted to. I've got this a gentleman who loved steak. I mean, he was the steak and eggs guy. Steak in the morning, steak for lunch, and steak for dinner. One of these guys, right? And he was had lost his teeth basically and had a denture. We were able to stabilize that denture, and upper and lower denture, 6 on the upper, 6 on the lower.
The mini implants.
Mini implants. And he left the office that day. I still remember saying, "Well, do you think I can try that steak?" I said, "Absolutely try it." And he did, and he reported back to me that it was the best steak he's had. Mind you, it was a rare steak.
Okay. So they really can eat whatever they want.
Yes, they can.
Because everybody's told you got to have fiber, things like that. But if you have a denture, it's very tough to probably chew.
Well, yeah. Plus, with a denture, they're usually having paste in their mouth. They have to use some denture adhesive. No one likes the denture adhesive. That doesn't work that well anyway. So to be able to use the mini implants to stabilize, you can get back to the fibrous things. You can eat those things instead of eating the steamed vegetables and all. You can eat your proteins. You can get back and healthy. So it's not just your desire to be able to eat, but it's healthier. You're able to function better. I consider myself a great cosmetic dentist, and I can spend a lot of time and use all my talents and artistic abilities to fit a front tooth onto a crown or a veneer, and would wow my colleagues. But there's nothing like being able to provide and give someone with no teeth. And they're one of the most appreciative patients that we have.
They ever give you hugs?
I have received hugs.
They bring you things like food?
Oh yeah, they'll bring me the brownies on the Friday. That's great.
Now, I guess the way it's normally done is you go to 2 places. One place where they place the implants, the mini implants, with a surgeon, and then you go to another dentist that puts the tooth on top. And somewhere else for the imaging.
Right.
You do it all right there.
We do.
What's the advantage, I guess, aside from just convenience?
Yeah, convenience is a great advantage, but where we're able to, well, you can imagine getting an appointment with the periodontist to get what gum situation you have or what disease removed, whatever's there, and then to get with the oral surgeon. These are all different appointments. And then to get with the person who's going to restore or give you those teeth.
The general dentist.
The general dentist.
Okay.
You're trying to manage all 3 of those different doctors, where in our office, we do it right from the start to the beginning. And me being a cosmetic dentist, that's what I love. I have a vision in my mind already what that's going to look like. So I can from the imaging, from the surgical part of it, placing the implants, designing the teeth, and then delivering the teeth. We can do it all in the one place, one environment. You're comfortable with us, and we're able to provide that.
So when it's all done, like let's say you take a denture and give them a full arch of teeth fixed on these mini implants that don't come in and out, how soon can they eat?
They can eat right away. I mean, we want them to eat right away. And after there's some adjustment period of time, they can eat and function just like you and I. I mean, there is
so they can chew chewy things?
They can chew chewy things. They can They can bite into the apple. They can have the hard carrot. Absolutely.
Now the roof of the mouth on these that you make, unlike I guess denture, the whole roof is covered.
Right.
These are not covered.
They don't have to be covered.
Okay.
There are instances where they are covered, but the whole idea behind placing those mini implants is to have that horseshoe look where that roof is uncovered. Because when it's covered, you're missing out on taste and temperature and all those things. Where we've got it just with those minis, you're still able to have the taste from the roof of your mouth. Your tongue can stimulate those tissues, and you have sensation of hot and cold. That's what's great about these. When the roof of the mouth is uncovered from being covered, and normal denture it's covered with plastic. When it's uncovered, patients love it because now they have a sensation of taste and temperature, and can once again feel and taste those foods that they've been missing.
Now you still make dentures.
Yes.
In your practice. Now why aren't you like shaking them up and saying, hey, get some mini implants and I'll give you a full set of teeth that are anchored in there?
Well, that's the problem. I do try to shake them because I think some of them are afraid of the surgical portion of it. They think they are expensive. And it's a process of learning.
Because you don't want to feel pushy, obviously.
No, obviously, but I look at it as stages too. If someone's not really interested there, we can make a full upper denture and lower denture with the idea of adding these in time when they feel like they need them.
So no more adhesive. I mean, once you do this.
Once you're able to stabilize those implants, and they're used, the mini implants, and they're used to hold that in, you don't need the adhesives anymore.
They like that.
They love that.
Do they really hate adhesives? I mean, is
absolutely. The taste. Can you imagine putting that on each and every day, or several times a day? And the taste of them has gotten better, but it's not like having your natural.
So no more traditional dentures.
They don't need to be that way.
They should all be. Your philosophy is they should all be attached.
Stabilized, attached to something. I mean, that's where it's at, and that's what we can do.
Now, how are these mini implants are different than regular implants?
Yes.
How so?
Basically, diameter size. They're a smaller implant. They're also quite a bit less in the way of expense, maybe half the cost. One of the misnomers about implants are that if you need them and you're thinking you might need 29 implants. No, that's not so. If there's a denture and we can stabilize it, we can use 4 to 6 of these mini implants, and they do a great job.
Now tell me about this, because I've had dentists on the show that say the problem with mini implants, they're just not there yet. They're not big enough.
They're absolutely
they fall
there.
Out.
They're absolutely there. FDA approved. We have long-term studies. I think I placed my first implant in 2007, and it's still very stable. Single versus multiple implants, they're very, very stable. Aside from they're less than half the cost, there's less downtime. We're able to place those in. We're able to get function back on those and stability back onto those implants much sooner than we could with traditional implants.
We're out of time, but what are the options? Okay, with mini implants. A patient comes in, you can't save their teeth. They're headed for dentures, right. But as you say, they don't want dentures. The other group, they're already wearing a denture. So what are their options when it comes to these minis?
Well, that patient that comes in that has hopeless teeth that need to be removed, those can be removed. Implants, mini implants, let's say on the lower, can be placed, maybe 4 to 6 of those on the lower, 4 to 6 implants on the lower, and we're able to make, same for the upper, we're able to make those dentures snap in and snap out.
Okay.
And they work great. With the idea, and the next level up from that, of course, is being able to make them cemented in where they don't come out. The roof of the mouth is open where they can get the taste and the sensation of hot and cold. I mean,
well, that's what people want, right?
That's what they want. Inevitably, that's what they want. And then there's those that are wearing dentures that are putting up with using the paste and powders. And we're able to stabilize those dentures by using, once again, those mini implants. We might put 4 on the lower, 6 or 8 on the upper, and stabilize that denture. With the idea, once again, that they go to something that's more that's more permanent, that stays in, that doesn't come out. I'm the only one that'll take them out.
And you just maintain them.
You maintain them like your natural teeth, just like your natural teeth.
Come in for cleanings, things like that?
Come in for cleanings, yes. Come in for cleanings, your hygiene. You still need to floss. You still need to do all those fun things, or those good things for proper dental health. And once they've had these placed, Randy, they're back in the system. Now they are more concerned about their dental health. They're coming in and seeing the dentist. They're getting their hygiene visits. They're making that. they feel more comfortable. They've gotten their self-confidence back. They're smiling. And, I've always said that you want to be around people who are successful and happy. And if you want to make someone happy, make them feel good about themselves, you smile. And that's what we're about.
Now, your two sons are dentists. Your daughter's a hygienist.
Right.
Your dad was a dentist. With your sons, are they going to be doing?
Absolutely. I mean, this is the future. No one should have a loose-fitting denture. I kind of feel bad for my father. He missed out because these mini implants weren't around. They weren't available in his time as a dentist. So great opportunities for us. Great opportunities for my sons who will be doing this, and great future for them. The whole purpose I think we have of dentists is to helping people feel better about themselves. And mini implants are a great way to do that.
Now, I think we should mention, Medicare, Medicaid does not cover the mini implants or dental implants. Even with the best insurance, dental insurance, it only covers a very small portion.
Right.
So what do you do for those people?
We have financing. We're able to, each and every day, I mean, we have financing options for everyone. When you come in for that visit with us and we talk of your options, we'll go over that financing. We make it affordable. We'll find a way to help you get.
So if you have OK credit, you can finance it.
Absolutely.
And people do it.
Every day. We have every day.
And okay, well, look, we're out of time. Final message. Somebody watching this, maybe they're headed to dentures, as you say,
right?
Loose teeth, or they're already wearing a denture. What do you have to say about mini implants for them?
I would say if you're in that state of life where you have dentures that are loose fitting, take a look at your options, because there's many options out there. Mini implants are awesome. They can provide and give you back the stability, let you eat and function, bring back your general health, and give you the smile that you wanted. And for those that maybe are heading to dentures, or in that way with loose teeth, make sure you ask your dentist if they provide those new smaller diameter implants, mini implants, because they will provide the retention and the help that you need.
Okay, good. And you offer a free consultation if
Absolutely.
somebody sees this?
Yes.
Do they get to see you?
They see me. I'm the only dentist there.
Okay, good. I want to thank you so much for coming on the show.
Appreciate it.
Very interesting.
Thank you.
Appreciate it. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.